if in case of some malignancies, is it helpful? And in case, which malignancies and why?
Yeah,
Or how?
it is being, in fact, it is being used widely for oncology and cancer surgery, because we can, because of the depth and the vision, you can see where, how much of the tissues are involved with cancer. So you can take just that out without damaging the surrounding structures. We are using now imaging, better imaging modalities. So we know pre-op itself how extensive our surgery is going to be. But when we get in there, we might be faced with different things. So we know the biggest advantage is the depth, how much it's how much the disease process has involved and infiltrated into the surrounding tissues. So that helps in improving that. Even with benign conditions, not just cancer, say there's a big ovarian cyst, like endometriosis involving the ovary, and the girl is looking at fertility preservation. So we know we can preserve the ovary by just, preserving normal healthy tissue as much as we can. Also endometriosis, it does affect fertility. So we are not causing too much damage. We are just removing the disease process to help improve outcomes. That is the biggest game changer, I will say, in gynecological surgery today.